My name is Joey.
My name's Imani.
My name's Tanaya.
And welcome to the Jet Show. So today we'll be discussing HIPAA violations. So the topic at hand is snooping a violation of HIPAA? So the case we'll be discussing today is a case of an EHR audit catching snooping employees. So before we get into the case, I just want to define a few terms that will be discussed. So HIPAA, according to the CDC, HIPAA is the Health Insurance Portability and Accountability Act of 1996. It's a federal law that requires the creation of national standards to protect the sensitive patient health information from being disclosed without the patient's consent or knowledge. And so EHR or EMR, it stands for Electronic Health Records or Electronic Medical Records. And a HIPAA breach includes unauthorized access by employees as well as third parties, improper disclosures, and the exposure of protected health information and ransomware attacks. So the case that we'll be discussing will be about a pharmacist. So according to McCann 2015, officials at the California Pacific Medical Center in San Francisco notified a total of 844 patients between January 23rd and after discovering a pharmacist employee had been inappropriately snooping on patients' medical records for the entire year. So the incident was discovered after the hospital conducted an EHR audit back in October of 2014. And so when they first discovered, they only found that 14 individuals had their records accessed or compromised. So the pharmacist was essentially snooped on the patient's records from October 2013 all the way to October 2014, including the patient's demographics, clinical diagnosis, prescription data, and also clinical notes from other physicians. The hospital reiterated to all employees and staff that their policies specifically states that only information can be accessed if it's used to perform a job duty, and violating this policy may result in a loss of employment. So, what do you guys think in this case? Like, do you think the pharmacist actually breached HIPAA?
I think that the pharmacist did breach HIPAA. If these patients aren't his patients, he was outside of his scope of practice, doing more than what essentially he signed up for to do. And he also violated the medical ethics, which is to protect the privacy of the patients. So yeah, I think he was wrong.
I have to disagree. I don't think he's wrong because he was given access to the files. So
I don't know, I think this case is kind of in between for me because it's like, yeah, one could consider that a breach of HIPAA, like just looking at people's records for fun and not really having a reason for them, but I also think it really depends on what they did with that information. So in the article, they didn't really, specify what the pharmacist actually did with the information. So one could just assume like he just looked at it for his personal leisure. So do you think the pharmacist should be blamed, or do you think like the medical record company should be to blame?
I feel like ultimately, even though the medical company did give him access to the patients, he is a grown man and made his own decision to go and look at these medical records that had nothing to do with him for his own pleasure. Like, what was the purpose of even doing it? And I know that he was fired, but that could make other patients not trust their pharmacists or not know who they can rely on to keep their information, or who knows what about them, right, which affects the patient to physician or patient to pharmacist relationship.
But I feel like in some of the other articles, they were saying like this is a big deal. Like, it's so many cases of HIPAA violations in this specific situation. But I feel like, okay, if this is happening so often, then like I feel like the companies should like do something I feel like they should just have your physician and the number of patients that they have, and they only have access to those patients. And I feel like it should be like a thing where you have to like request to click on a different patient's records to view all their whole chart.
Yeah, I agree. To piggyback off what you were saying, if the hospital seeing that HIPAA violations is very common or is happening, they should take the precautions in not giving everyone access to the files. Because with that, things like this would happen. It wouldn't have happened if the access wasn't there. So,
But it's saying that the purpose of medical records is to provide planning tools for patient care and to record the course of patient treatments and the changes of patient's conditions. So let's even take it a step further of the pharmacist and let's change it to a physician. Like, for me as a physician to have to request access to say, Amani, you normally go to John Hopkins, but I work at Mercy, but you just got shot in your leg. Why I'm gonna have to wait for John Hopkins to send me all of your stuff when I need it now?
No, I don't think it's like you gotta wait for them to send it, but I think like everybody gonna have your medical records, but it's like you have to request it. So like I feel like the EMR system should approve that.
Mm-hmm.
And then once you get approval, like all the records is there. But I get what you're saying.
Yeah, like I don't want to have to wait, and then in that time period of me waiting, you dying, whether I can just be an adult and know my code of ethics and the oath that I've taken to know that I'm not supposed to be looking at your records without you being my patient.
in that case, though, there would be a pharmacist already on, the patient. It wouldn't be just like no one's on it and someone's waiting for access. Somebody would be placed on the case who have access, and then anybody else that is not part of the case wouldn't have access, but to get access, they would need
To request it.
to request it. So then it wouldn't be.
That's confusing to me because, like I said, if she normally go to John Hopkins and you her physician, but something happened where she got to come to Mercy, and I'm now her physician to treat her treatment right then and there, I was never on the case. But that could be a life or death incident to where I need to get to her stuff. So it's like the pharmacist and physician need to have better control of themselves to not be nosy and just want to look at people with their stuff.
These are people we're talking about. Like I feel like, yeah, what is the actual point of like looking at different people's medical records and their charts if you're not going to use them at all? But I also kind of feel like there's like really no harm. Like if you're not spreading the information, if you're not stealing the information, like using it against that patient, then I don't think it's a huge deal. Because just being that, like when I worked in a hospital, I also have like access to all the patients' information in the hospital, and they could definitely tell like when you veer off from your department. So like if I was working on the ortho floor, and if I wanted to look at a patient's chart in the ER, you could get access to that, but they're definitely gonna know, and they're definitely gonna say something to you about it. But I don't know. I feel really conflicted.
Pharmacists to be fired off of it without having any. Again, like you said, he didn't do any harm, or they didn't prove he did any harm. So therefore, what was the reason for him being fired?
Because he signed, it was a part of the policy.
Yeah,
and when he signed his contract, he agreed to that policy.
Yeah.
He did. Okay.
So he violated his contract and HIPAA at the same time.
Yeah, because in the article they said that the hospitals reiterated that all staff policy allows them access to patient information only when necessary to perform job duties, and violating this policy may result in loss of employment. So he did get fired, but I don't think he got fined.
Okay.
But in some situations, you can be fined for HIPAA violations. Like that case you was talking about where somebody broke into a doctor's car and like stole their flash drive.
Mm-hmm.
Like, and had all the patient information on there, you could be fined for that, and also jailed, depending on how serious it is.
But that's also on the pharmacists that had all those patients.
On the flash drive?
Yeah, why do you have 2,000?
It's not his fault his car got broken into.
Yeah,
But why do you got it in
have
his
2,000?
car?
He has 2,200 patients' files
In
that
his
thumb
car.
drive. He's not working on 2,200.
Those probably
should
his,
never
like
put it
his
at
past
home.
patients.
It could be.
But why is it in his car?
Because he was probably trying to go home.
But why are you trying to take it home?
To work. Okay, so, is consulting another doctor's on a patient case a breach of HIPAA? Who wants to go first?
I'll go first. I don't really think it's a breach of HIPAA because if a doctor needs help, well, first of all, it improves the quality and like reduces like mistakes and stuff because you have a second eye, and they may know what they're talking about. So in that case, in the case that we were talking about right now, where the pharmacist got fired for going through 800, is 800?
Mm-hmm.
So what if he saved all 800 of those patients through snooping? Then how would it be viewed? Would it be viewed as still breach, or would it be viewed as a good call?
But are those like, are you saying like, oh, he caught a mistake of somebody else's because he was snooping, or like
It could be
he saved like their lives because he treated like those were his patients?
I mean, it could be either or, but it could be the case of you, let's say you're working on the case and you ask me for help and I pick up on a mistake that
I made.
Yeah, but I looked through it myself,
Okay, then that makes sense because it's like, well, you have a reason to be looking at their cases and like their charts and stuff. So like, okay,
So, I mean, I feel like, yeah, if the person that you're disclosing the information to have no reason, no helpful ideas, no part, or is not necessary for the care of the patient, then yes, it's a breach of HIPAA. Also, depends on how you tell the other physician or pharmacist and where you tell them at, because if you're out in the cafeteria or behind the pharmacy desk and you're telling the name and the age and all of that, other people can hear you.
mm-hmm.
So that's a breach of HIPAA. Like, I can go find this person, this Joe Jones that's 23 that live here out on the street. And if you're telling, like, say, like I was saying, you telling a cardiologist information about this person, but really this man has a brain tumor, it's like he has no legitimate interest in the patient's health. You're just basically gossiping at this point.
Mm-hmm.
So that will be, when it feels like gossip, that's a violation of HIPAA.
Who said that?
Right here it says in this book, disclosure may be made under compelling circumstances to a person with legitimate interest in the patient's health. A cardiologist is not going to be interested in a brain tumor.
True. Ooh, so this has made me think about Grey's Anatomy. So you know how they be in the cafeteria talking,
Yes.
they be talking. Are they violating HIPAA?
I'm trying to
Like when they're just having like conversation about their patient, but like they're asking, like their friend is not on the case, but it's a case that they're working, but they go to them and ask them and tell them about the case for like more information.
What if they have relation? Well, like, so I don't know if it's possible, but what if something with the cardiovascular system has like caused the brain tumor? Then in that case, like you're seeing a brain tumor, but to him he's seeing the cause of the brain tumor. But
Yeah,
you
but-
wouldn't ask him thinking because he's a cardiologist. You wouldn't ask him just
Mhm.
thinking.
I think like the test that would be ran would prove that, like, okay, it's something going on with the heart that's causing, this situation. But back to the Grey's Anatomy situation, no, I don't think that's a breach of HIPAA because they were resident students.
Mm-hmm.
They haven't picked their field of training. Like, they haven't had their, like, I think it's called their decision day or whatever.
Yeah, but like they're not, but they still be assigned to like certain cases.
Yeah, but for them, like, but they're going all around. So 1 week they might be in cardio, 1 week they might be
Yeah,
in
but
neuro.
that don't mean they're gonna have that specific patient though. Like that they friend was working on that week.
What I'm trying to say is, like, if I'm just a general doctor
Mm-hmm.
to where I have knowledge in every single aspect of the body, I feel like you will be able to come to me no matter what the situation is because I have knowledge in all aspects of the body. To where if Joey was just, we're gonna go with the cardiovascular doctor, he he has specified his research and knowledge in the heart to where he might know a thing or two about the brain or the intestines of things like that, but the most that he knows is how it's connected and works with the heart and how
So-
it affects the heart.
So you don't think he'll be able to like consult on the other doctor's case?
Not even don't have nothing to do with the heart.
So, a well-rounded doctor doesn't mean that, because like, so let's say you may have a good, like, a lot of each,
Mhm.
but you don't have enough for each. You just know a lot of each category. Whereas
Right.
a cardiologist may specialize in that one category and know
Right.
a lot more than you know.
Right.
So in that case, I wouldn't go to you just because you're well-rounded. I'll go to whoever knows more on something that may be related to the patient I'm dealing with.
No, if a patient has a blood clot in the leg, I'm not going to go to you about the heart. I'm going to go to a well-rounded patient who knows about veins and arteries and blood and
But
veins.
blood clot
Yeah,
goes to the
that goes in
to the heart.
But it has to make it there. It hasn't made it there yet.
But-
So when it gets to that point, then I'm gonna consult Joey. Like, okay, we have to do this. But
So
I need to stop it from getting to the heart. So I'm not gonna consult him.
So who else would you consult if it wasn't a cardiologist or a well-rounded doctor? Like,
I would consult about like a general doctor, or ER doctor,
Mm.
like a person who has studied the overall of the body. Just like you wouldn't go to even though you can get a stroke from a blood clot, pumping from the heart to the brain, I'm not gonna go to a cardiologist when the stroke has already happened. I'm gonna go to a neurologist because now we have to figure out how to save the rest of the brain. Question is, what ethical issues do you think this case brought about?
So with this case, I feel like the code of conduct was definitely violated, and it was also an intentional tort. One of the intentional torts because it was an invasion of privacy. But I also feel like no harm was done to any of the patients either. But it was definitely a violation of the code of ethics and an intentional tort.
I feel like it was non-malfeasance done, like the do no harm, because when the patients eventually found out that he violated and accessed their medical issues, it again caused a breach in the patient physician trust, as well as probably the hospital, the whole organization. Patients probably don't want to come there anymore because they feel like, oh, if I come to this hospital or I come to this, use this pharmacist, other pharmacists are able to access my information.
Mm-hmm.
So I feel like it did cause harm with the trust from the patients to the organization.
Okay.
I mean, so I agree with what you said. A lot of things really could have went wrong with this case, but he didn't use the information for bad because he's been doing it for a while. They never found out. I don't think they didn't find anything out after. They didn't state. So he couldn't do it for a good reason. So then I feel like his ethics for him ethically would have been correct, or right.
Okay, so where do you guys stand? Like, what's your positions? Are you for, you against? Now that we had this discussion, like, did your stance change?
Well, I'm not for him going through, patients' files without them knowing, but the reasoning does matter, and I don't know that, so I would say in general, I would just avoid going through. I'm kind of against it. I'm against it. Yeah.
So you don't think snooping is a violation of
No,
HIPAA?
I think sniffing is a violation, but for the reasoning matters. But in this case, I don't. I think I'm for it.
Okay.
Okay, I still believe that any type of snooping is a violation of HIPAA because no one's asking for your help. No one's asking you to look at it, but you're using it for your own personal gain.
Mhm.
And once you add personal reasons, just like for the reasons of you not being able to treat your family members because of personal interest, once you add your own personal interest, all of your medical ethics and reasoning and codes go out the window. So I feel like it's a violation.
Okay, well, I don't know. I feel kind of still neutral about it because, like Joey said, it definitely depends on the reasoning and what you're using it for, and also if it's used for personal gain. But if you're just like a super nosy person and just want to see what's going on,
This is the food for you.
yeah, because
This is your field.
if you get caught, you're gonna get in trouble. Personally, I feel like it's not really a violation of HIPAA, but like technically, according to the law, it is, and according to the hospital policy that they implemented, and they did, and the pharmacist did sign a contract agreeing to that, then it is a violation of HIPAA. But that is all. Thank you guys for listening. This concludes the Jet
Jet
Show.
Show.
Jet show.